Ultrasound trainings. Normal early pregnancy ultrasound. Legal disclaimer. Information is for general and informational purposes only. Content is not or nor intended to be a substitute for professional, legal, or clinical advice. While we strive to make the information as timely and as accurate as possible, we make no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the information contained, and expressly disclaims liability for errors and omissions. Course objectives. By the end of this course, it's implied that the students will be able to verbalize the early pregnancy ultrasound, what it is and how you obtain it. Students will be able to verbalize the clinical methods of estimating gestational age. Students will be able to verbalize estimating the delivery date, and students will be able to verbalize the assessment of gestational age. Early pregnancy ultrasound is important and is widely used. It's used to date the pregnancy and get an estimated due date. Why is this topic important? There's many reasons why this topic is important. Early pregnancy ultrasound is very important. Each pregnancy and person is different, and early pregnancy ultrasound is important and helps with care plans and decisions. It helps healthcare providers tailor their care plans to the specific needs of each pregnancy and ensures appropriate timing for interventions and delivery. It helps to determine the gestational age of a fetus, which helps guide the care of both the fetus and the pregnant woman. It reassures expectant parents and forms the basis for informed decision-making, appropriate interventions, and the overall well-being of both the mother and the developing fetus. Antenatal ultrasound. So in ultrasound, it's very hard to see anything before 4.5 weeks of pregnancy. It's very limited. You may see something, you may not see something, but starting at about 4.3 to 5 weeks, it's possible that you will see a small gestational sac, a possible double decidual sac sign, which is DDSS, and a possible intradecidual sac sign, which is IDSS. At 5.1 to 5.5 weeks, the gestational sac should be visible by this time, and at 5.5 to 6 weeks, the yolk sac should be visible by this time. The gestational sac should be about 6 millimeters in diameter, and you'll see something also known as a double bleb sign. Also, I might add that early pregnancy ultrasound in the first trimester is usually done most of the time endovaginally, just because you can see more up close and with more definition, more accuracy as well. A pregnancy greater than 6 weeks, you'll see a fetal pole may be identifiable on endovaginal ultrasound, 1 to 2 millimeters in length. The fetal heart rate should be about 100 to 115 beats per minute. Gestational sac should be about 10 millimeters in diameter. At 6.5 weeks, you'll start doing a crown rump length, or CRL, and should be about 5 millimeters. 7 to 8 weeks, you'll see a CRL between 11 to 16 millimeters, and it's done by measuring the cephalad and caudal poles that can be identified for the crown rump length. And ultrasound can also determine if everything is progressing properly and helps the doctor to understand if there's any developmental abnormalities with the pregnancy thus far. So a lot's happening during early pregnancy. The pregnancy is rapidly developing. Between 8 and 9 weeks, the CRL, or crown rump length, is between 17 to 23 millimeters, and limb buds appear. The head can be seen as separate from the body. At 9 to 10 weeks, the CRL, or crown rump length, is between 23 to 32 millimeters. The fetal heart rate is between 170 and 180 beats per minute. A fetal movement can be seen this early in pregnancy. That's so amazing to me. A round hypoechoic structure in the fetal brain shows a developing embryonic or fetal rhombencephalon, and nuchal translucency may be seen in this stage as well. Okay, so as I stated before, early pregnancy is usually done transvaginally, or also known as endovaginal. During this time, when you're scanning the patient transvaginally, you'll see up close and personal with the pregnancy and with a lot more accuracy. So when you are scanning, you'll see an intradecidual sac sign, or IDSS, which is an early sign on a transvaginal scan. When the MSD, also known as the mean sac diameter of the embryo, measures 25 millimeters, an embryo must be visible. If it's not visible, it can be a sign of a failed pregnancy, but we'll get to that later. When the CRL, or the crown rump length, measures greater than 7 millimeters, an embryo must show cardiac activity. An embryo should be seen less than or equal to 14 days after a sac with a gestational sac without a yolk sac. An embryo should be seen less than or equal to 11 days after a scan with a gestational sac and a yolk sac. So in other words, these are different parameters that are telling you what you should see at different stages, and if you don't see them, then it can indicate a problem. So we also do transabdominal scanning, maybe a little tougher in first trimester pregnancy due to the size of the pregnancy and how early the pregnancy is. And also, you need a full bladder. The patient needs to have a full bladder for you to be able to see anything in very early pregnancy. But when you do see something, the mean sac diameter, or MSD, should measure 20 millimeters and a yolk sac should be visible. When the mean sac diameter measures 25 millimeters, an embryo must be visible. So occasionally, an early pregnancy is unintentionally imaged by CT, or sometimes MRI is done for other reasons other than pregnancy, and patient may not even know that they're pregnant thus far. And it's important to know the imaging findings on these types of exams. So you'll see a fluid-filled cystic structure in the endometrial cavity, well identified on MRI and may be visible on CT, especially on delayed post-contrast images. You'll also see a developing placenta, and that's seen as a curvilinear enhancing structure. A fetal pole may be seen in delayed first trimester imaging. A corpus luteal cyst may be visible in one of the ovaries. A unilocular cyst less than 3 centimeters with irregular crenated and enhancing walls may be visible as well. So there can be differential diagnoses to having a positive urinary pregnancy test, and that can include ectopic pregnancy, missed abortion, gestational trophoblastic disease, and unfortunately, these are some things that happen with pregnancies, and ultrasound can help to determine the next steps of the process, or if there's nothing wrong. So it can determine if there's a pregnancy or if there's things that are happening that should not be happening. If the urinary pregnancy test is negative, similar findings may suggest submucosal fibroid or retained products of conception after, such as like a D&C or a miscarriage, and products are left over, so that can be seen as well. Menstrual history. So traditionally, gestational age is estimated from the date of the last menstrual period, or LMP, assuming that conception happens on day 14 of the cycle, and if that person has a normal ovulation and menstrual history. Women with irregular periods or irregular ovulation, oligo-ovulation is the term, like polycystic ovarian syndrome, it may not be very accurate. If conception occurs during use with oral contraceptives, LMP cannot be used as it does not correlate with ovulation timing. So, in other words, This method can be a faulty method, so now the use of early pregnancy ultrasound is what happens next. So knowing the date of a pregnancy test, your first pregnancy test, the positive obviously, allows the calculation of a minimum of gestational age. This depends on the sensitivity of the test. For example, if the test was performed 4 weeks ago and the test is known to return positive results as early as 1 week after conception, then the minimum conceptional age, or CA, would be 5 weeks. Gestational age, 5 plus 2 equals 7 weeks of amenorrhea. So positive pregnancy test is the first date you go by when trying to figure out proper gestational age. So pregnancy following assisted reproductive techniques such as IVF, which is in vitro fertilization, or IUI, which is intrauterine insemination. In IVF pregnancies, gestational age can be accurately determined from the time of embryo replacement, while conception might be delayed slightly in IUI pregnancies. For patients who undergo ovulation induction, GA is calculated from the day of human chorionic gonadotropin administration. So another type of exam that can be done is a clinician or physician can check the uterus size just by palpating it or feeling how large the uterus is. And with it being a certain size, they can guesstimate typically what gestational age the pregnancy is. Sometimes it can be misleading or inaccurate based on if there's been multiple pregnancies, so the uterus is kind of stretched out. Uterine fibroids can make the uterus larger as well, or a full bladder. Tape measurement is used from the symphysis pubis to the fundus, or the top of the uterus. It may be useful up to 28 to 30 weeks gestation, beyond which becomes too inaccurate for dating. So perception of fetal movement is a great sign and a good indicator that things are progressing, but is not used really by physicians or clinicians as any type of diagnosis to go off of. Usually you will feel your baby moving, or the patient will feel the baby moving between 19 and 21 weeks gestation in nulliparous women, which is first pregnancy, and 17 to 19 weeks in multiparous women who've had multiple children. Before the advent of pregnancy tests and ultrasonography, quickening was often the method by which a suspected pregnancy was confirmed. However, at present, it has little diagnostic value. So, a very important piece of information that needs to be determined in every pregnancy is the expected date of delivery, or estimated due date. It allows the doctor or clinician to basically know how far along the patient is and what should be occurring at each stage, so they can monitor and make sure that the pregnancy is progressing properly. Only about 4% of babies are born precisely on the estimated due date, and pregnancies often extend beyond this date, so there is some variability. It's not foolproof. Counseling pregnant women about the variability can help manage maternal anxiety, so it can kind of tell or reassure the mother that everything is fine. It can vary a little bit. The median length of human pregnancy is 280 days from the first day of the last menstrual period, or 266 days from conception. Preterm birth is termed delivery before 37 completed weeks, while postterm is after 42 weeks. Maternal characteristics minimally affect gestational length, but obesity increases the likelihood of postterm delivery. First trimester. So determining gestational age is most accurate during the first trimester. So specifically between 8 to 12 weeks when growth rates are consistent. Commonly used measures to measure the gestational sac can be visualized from around 5 to 6 weeks and grows approximately 1 millimeter per day. Its mean diameter is measured and compared to standardized values or input into ultrasound machines for estimation. There's also a crown rump length that is done from the weeks of 6 to 14 and is the most accurate method. Measured from embryo's head to the rump, excluding the limbs and yolk sac. Ultrasound machines typically provide age estimates based on these measurements, or reference to published tables or regression models can be used. So in a nutshell, first trimester ultrasound can be limited with what you can see, but when you do see ultrasound, the pregnancy itself, you can determine the age of the pregnancy most accurately during the first trimester, but can't see too much detail until the fetus gets larger. So just remember, as stated before, it is much easier and more accurate to date a pregnancy in the first trimester. So in the second trimester and the third trimester, it's less accurate due to growth variations and genetic differences in the fetus. So in second and third trimester, we utilize multiple measurement methods to make it more precise than relying on a single measurement. So 5 commonly used methods during second trimester. These are all different measurements that are used. Crown rump length is used in the first trimester primarily, but can be used in the second up to 14 weeks of gestation, and it's equivalent to the biparietal measurement after that. So accuracy is within 8 days. The biparietal diameter is measured on the head, and accuracy within 3 to 8 days in the first trimester and 7 to 12 days in the second. It's measured in an axial plane to ensure symmetric views of both hemispheres. Head circumference is accuracy within 7 to 12 days, potentially most accurate in the second trimester. It's measured in the same plane as the biparietal diameter. Abdominal circumference is accurate within about 7 to 15 days in the second trimester, obtained in an axial and transverse plane at the point of portal vein bifurcation. And the femur length is accurate within 7 to 17 days in the second trimester, and it's measured perpendicular to the length of the femur, excluding the cartilage. So dating a pregnancy in the third trimester is the least accurate. So measurements that we use, just like in the second trimester, abdominal circumference, femur length, and head circumference is utilized to determine gestational age, employing the same measurement techniques as in the second trimester. However, dating accuracy decreases during this period. Abdominal circumference is accurate to within 18 to 35 days, while femur length has an accuracy of about 21 days. Repeat testing and follow-ups are recommended during the third trimester due to decreased accuracy of dating. In conclusion, early ultrasounds conducted in the first trimester provide essential information about the early stages of embryonic development. Subsequent ultrasounds in the second and third trimesters will provide more detailed information about fetal anatomy. Assessment of gestational age with ultrasound is a critical element of evaluating a pregnant woman in any healthcare setting. Ultrasound can be used to different levels of gestational development to determine the age of the growing fetus, and determining the correct age impacts later care of the woman and fetus and may affect dates that determine the viability of the fetus, expected delivery date, and appropriate growth rate. So remember, the most accurate method to determine gestational age is during weeks 8 through 12 when the crown rump length can be determined and the fetus is in its greatest and most consistent rate of growth. The earlier in pregnancy a scan is performed, the more accurate the age assignment from crown rump length. The initial age assignment should not be revised on subsequent scans. Overall, the accuracy of sonographic dating in the first trimester is about 5 days difference, so 95% confidence range. That's pretty good.